Good morning, everyone. Welcome all of you joining the public presentation organized by the Occupational Health Center. Today's topic is really important for the workers, especially the work outdoor, right? And then we so appreciate to have André Gauvin. He is the occupational hygienist from the Occupational Health Clinics for Ontario workers to do this important topics, learning about the new evidence-based tools, this heat stress toolkits they just launching in about a few weeks ago. Yeah. I just want to introduce, Andre to all of you, if some of you doesn't know about him. He is occupational hygienist with the OHCOW, with over 15 years of experiences in occupational health. André is a graduate from Gauvin University with Bachelor of Science in Kinesiology and a Master of Human Kinetics. He started his career in ergonomics and he's made the transition to occupational hygiene in a few years also. And also he is a Canadian certified professional hygienist and certified industrial hygienist too. For beginning the session, we would like to acknowledge we are gathered on Treaty 1 territory, that Manitoba is located on the territories of the Anishinaabe, on the Nunavik, Nunavik, Dakota, Oyate, the Nesunini, Inuit, and Haudenosaunee nations, and on the national homelands of the Red River Métis Nation. We acknowledge that northern Manitoba includes territories of the Inuit. As we gather on Treaty 1 territory, we also recognize Treaty 3 territory, in particular Salt Lake 40 First Nation, the source of Winnipeg's clear drinking water. We also acknowledge Treaty 5 territory, including Nelson River, which provides us with access to most of our electricity. The Occupational Health Center acknowledges the devastating, lasting, and ongoing impact of settler colonialism on Indigenous people and the key lack of action toward truth and reconciliations. OHCOW has embarked on a process of learning about Indigenous people, history, and culture, and our roles as settlers with our staff, the board, and volunteers under the guidance of knowledge keeper Clayton Sandy. We commit ourselves to active accountability, truth, justice, equity, and reconciliation. For some of the folks that know about this session, and also we will be recording, and also after that we're going to share the slide as a PDF format. So as request, you could send me the email to request a copy, and also I will send you the link of the recorded session as well. And also you can see we have the Q&A, so please put your information and comment and question on the chat session as well. Occupational Health Center, if some of the folks are coming from Ontario, I know some people coming from our province, not just only from Manitoba. Welcome you to joining us. You can see that we are the Occupational Health Center is a community health center funded by the Winnipeg Regional Health Authorities. We are located on 167 Sherbrooke Street, Winnipeg, Manitoba here. We provide the services to the Manitoba workers with work-related health issues. And also work closely with the Joint Workplace Health and Safety Committee for training. All our service is free, and you could also visit our website for more information. I will put the website link on the chat. Now, please join me to welcome André Gauvin.
Thanks, Tiffany. Okay, I'll just share my screen here. Okay, can everybody see it?
Yes.
Okay, I'm just gonna turn my camera off so that just for bandwidth here. Stop. Okay, well, thank you, Tiffany. Again, my name is André Gauvin. I'm an occupational hygienist with the Occupational Health Clinics for Ontario Workers. And we'll be talking about the new heat stress toolkit that we developed in the last year or so. Well, really the last 7, 8 months. So let's go through why, really. So really with the increasing in change and climate change, we're seeing a lot more exposure to heat. And globally, temperatures are rising everywhere. It's not only in Ontario, this is happening globally. So it's really an extreme case here for climate change. So there is extreme heat all over the place, and it can contribute to chronic illness, and it's associated with regular loss of outdoor labor time. So there is a greater need for heat stress regulations and tools. In Ontario, there was a proposal for regulation. We don't have it yet. We provided a submission for change on certain things. But yeah, we're working towards a regulation for heat stress. So we had funding from the Ministry of Labor to develop new tools to help manage heat stress. So that's what we're going to be talking about today. The other thing is when you're looking at the Ontario Climate Change Report, there is kind of a delay there. So in the report, it says we had an average days of an average of about 9 days above 30 degrees Celsius. So we just went through a heat wave here in Ontario. And if you're looking at 22, 23, we're above that average in our major cities. So if we're looking at Windsor, Toronto, Ottawa, we're above that average of 9 days. If you go Northern Ontario, Sudbury, we might have been in that average around 9 days. But already here in Sudbury, Northern Ontario, we've already had 5 days in the last heat wave that was above 30 degrees Celsius. So that included Sunday, Monday, Tuesday, Wednesday, Thursday, and then Friday today, we're going to see about 27 degrees. So I don't know if it's the same in Manitoba, but in Ontario, we are seeing some pretty extreme heat right now. So this is I'm sure some of you have seen the old OHCOW awareness guide, the heat stress awareness guide. Again, that was developed in partnership with health and safety, the health and safety system in Ontario with OHCOW. So basically, we've updated that to the new toolkit. So this is what we're looking at now. We have the heat stress awareness guide, which is basically a tell all about heat stress. It's a little bit more technical. It's more for the specialists. It has a lot of detail in it about what is heat stress, thermal regulation, which we're going to talk a bit about today, different heat stress conditions or illnesses, even long-term and chronic illness, which is new to the guide. And then we have a new prevention monitoring guide. This will go through, or physiological monitoring guide, I should say. This goes through, wearables that you can have to monitor heart rate or skin temperature, and some matrices as well, just like checklists that you can do just to monitor physiological health. And then we have the prevention tools and strategy. This is the guide that we're going to concentrate on today. This is more, if you take this guide, you can basically just take this guide and implement a heat stress management plan that will work for your workplace. So we go through different strategies that you can use to implement a heat stress management plan. So who is our audience for this guide? So what we're trying to do is we're trying to reach, actually it's the audience is who we're trying to reach and what we want them to do, not just know, right? So when we're thinking about that, a lot of times we put something out and we just say, okay, well, here you go, you need to know this. But now we're trying to implement something where we want them to do this. So in this guide, we actually have an SOP as well. So you can grab that SOP. If you don't have the heat stress management plan, you can grab that SOP and just implement that, and you have a heat stress management plan. You can tailor it to your workplace, but this is pretty general, but it could work for basically every workplace. So our direct audience for this is really heat stress exposed workers, health and safety reps, supervisors. You can have some program managers as well, senior management, basically everyone. The health and safety specialist might go more towards the more technical pieces, which is fine as well. So since this project was originally produced by, the OHCOW committee, so all the prevention partners in Ontario, we thought it was important to kind of do that again. So we re-engaged everyone. We have the Ontario Health and Safety System partners that we re-engaged and had meetings and discussed this with. The Ministry of Labor in Ontario, a few unions also joined, and the Ontario Federation of Labor helped us with this as well. So let's go through a little bit of what's happening. So really, as we're exposed to heat, basically it's time to change your body's thermostat, right? So from heating to cooling. So instead of trying to keep the heat in, your body turns into okay, now I got to start losing heat. So it's heat loss mechanisms that start to kick in. So when we think of thermal regulation, how does that work, right? How do we lose heat? Well, as your body gets warm, you'll see that your blood flow changes. So in normal circumstances, your body will look something similar to this, right? 20 degrees, like most of us are today. If you're sitting in an air-conditioned area, this is what your body mapping kind of looks like in terms of heat. So your core will be around 37 degrees. And then as you get farther towards the extremities, it gets cooler and cooler. So what's your body trying to do is trying to keep that heat in to keep your core warm. So you have that vasoconstriction of your arteries. As your body gets warmer, this is kind of the profile that we're seeing now, right? It's getting a lot warmer. Let's say you're working outside in 35-degree weather, or even just standing outside. Your body's going to try and get rid of that heat to cool your body off. So what happens is your arteries vasodilate, so they get bigger, and that helps push a lot of that heat to your skin, and then it radiates heat from there. So what's really the critical organ? What's the most important organ that's susceptible to heat stress? So normally this is a question I would ask in person, but so what body part do we really need to worry about most? So this is the brain. So when the brain gets too hot or above 40 degrees Celsius, the thermal regulatory system really just shuts down. So, as you start getting into that 38 degrees, you start sweating heavily, your body's trying to cool off naturally. And then, if you hit above 40, your brain's like, holy moly, I'm way too hot. I cannot do this anymore. It shuts down all your systems. This is at the point where you go into heat stroke, you stop sweating, your skin is hot to the touch, but your brain is not responding. It's just, it's trying to shut down all your systems to try and cool your body off as much as possible, and to protect itself. And this is a really dangerous situation. So how do we feel when we're exposed to heat? So what kind of symptoms have you experienced? So if you think about things that you might have experienced, we get into different things here. So you have heat edema, heat rash, heat syncope, so fainting, then it'll transition to heat cramps, a little bit of and dehydration, heat exhaustion, heat stroke, chronic health effects, and heat strain carryover. So there's a lot of different things as you get warmer. And one of the things, so when we think of thermal regulation with the aging population, so carrying over heat stress, that's another thing that, we think of acclimatization. As you're exposed to heat stress over a period of time, your body will adapt. But there is some studies out there that in the aging workforce, it's actually worse. So as you carry over stress or heat stress, the first 2 days your body starts to adapt, and then after the third and fourth day you're actually getting worse. So your condition, like you're under more stress, so you're not actually adapting to that exposure to heat. So it's something to think about for workers that are 55 and older. they may not respond to heat the same way as a younger worker. So transient fatigue. So what is that? Basically, it's general feelings of tiredness or fatigue. So you might feel this initially when you start working the heat, you feel sluggish. And you know, what's the remedy for that is, you know, drink more and take a break when you need it. Heat rash, so that's more of an irritation of the skin. It's blocked ducts, so it's or sweat glands. So what happens here, that you'll typically see this if you're working in a dusty environment and with a lot of heat. So your sweat glands will open up to try and excrete sweat and cool off your body. But as a result of that, if you're working near dust and things, it might fill up with sweat and dust and cause these bumpy. It looks like pimples almost, but on your skin, and it's really itchy. But yeah, this is what a heat rash would look like. I'm sure many of you have experienced that. Heat syncope, so fainting, signs of fainting. So basically with this, this can happen early on in the heat stress season. So as you're exposed to heat, and a lot of that, this can happen also after eating. If you're sitting down in the heat, you're eating, and now your body is starting to digest food, right? So your blood is now going from your skin, because you're taking a break. It's not, you know, actively going to your muscles, into your skin that much to cool you off. It's going to your stomach to digest. So then you start, you know, you get up to start working, and that transition, sometimes people start to feel faint, and they may pass out. So this is something, you know, that with time you'll adapt to, but again, it's another risk. So there's difference between heat syncope and heat exhaustion, heat stroke. So there's a different way that it progresses. So we'll talk a bit about that. So heat cramping. So this is usually due to dehydration. You might not have enough electrolytes in your blood. So if you do have some cramping, you know, drink more fluids, and electrolyte supplements are good. Something like Gatorade or Powerade, and then rest, obviously, in a cool environment to try and have a remedy for heat cramps. So heat exhaustion. So when we think about heat exhaustion, we're looking at nausea, dizziness, headaches, blurred vision, profuse sweating. So a lot of sweating, wet, cold, cold, wet hands, grayish skin. You might have a weak pulse. So the first aid for this is, you know, lay the victim down in a cool area, give them fluids, make sure you speak to them, keep them conscious. And if they're unconscious, then you seek medical care. This becomes a medical emergency. They're basically into heat stroke. So this is kind of the progression there. If somebody, you know, faints in terms of whether it's heat exhaustion or heat syncope, heat exhaustion or heat stroke, I should say, really. Once you get into heat stroke, you have chills, restlessness, irritability, red, hot face. You might feel disoriented, hot, dry skin. You're not really sweating anymore. And then you may collapse. You can be unconscious, have convulsions, and even death. So this is a medical emergency. If you see anybody nearing this, so, you know, when the headaches, vomiting, nausea, when that starts, it can lead from heat exhaustion to heat stroke very quickly. So if it does start, you make sure that they take breaks to try and make sure that they're not gonna, you know, become unconscious and or be sicker. But so that is kind of the difference. So if you're looking at heat syncope, someone might just get up and boom, that lack of blood flow going to the brain, just it makes them you know, kind of pass out or faint. But then if they're fainting after, you know, feeling a lot of nauseousness, they're complaining about a headache, they're complaining about, or maybe not complaining, but they're feeling it, and then they faint, then you're in an emergency situation. You need to call 911 as soon as possible and try and cool these cool the patient as best as you can. So what are other side effects of experiencing heat stress? So besides the obvious effects of heat that we just talked about, so the acute health effects, what else can be affected? So we have reduced work performance, and that's usually because, workers are tired, they're fatigued. There's also increased accidents because they're tired and fatigued, and their accuracy isn't as good. So they're more susceptible to injury. Reproductive problems. So heat has been shown to reduce both male and female fertility, and can be a problem for the fetus as well. We have heart and lung strain. If you already have a heart, lung, or kidney or circulatory problems, heat stress is an added strain on your body, which in severe situations may precipitate serious episodes of acute problems. And then poor morale. So working under heat stress conditions, most people don't like it. It can aggravate, if the morale is already bad, it can aggravate that. And it also can produce some labor relations problems, like people get into different arguments because of heat. Like your worker might be pushing you, saying, oh, well, no, like, yeah, it's hot, but it's not that hot, so you got to keep working, right? There's a lot of that as well, and that can create more poor morale. So we have a toolkit really for that. So that's what we're here for. So who is most susceptible to heat stress? So what are the predisposing factors? Well, a very small body size, people who are overweight, people who are over the years of, or 40 years old. So the older you are, the more sensitive you are to heat. If you've had a previous heat illness, so if ever you've had heat exhaustion or heat stroke, you're more susceptible to heat exhaustion or heat stroke again. If you have heart disease, high blood pressure, diabetes, if you're inactive, if you're very physically active, so sooner or later, we're all vulnerable. So really, this toolkit can apply to everybody, not just, the vulnerable population or workers. It's everybody. This is who we're targeting. It's absolutely everyone who's exposed to heat, because we're all susceptible to heat stress. So who typically gets heat stroke when you're looking at all these people? Well, young men and sick older people, physically fit males. A lot of the times it's athletes, people who have pushed their bodies to the limits for a long time and they don't know when to stop. And those are usually young, fit males. And these are two here that have succumbed to heat stress. And then, older people as well. Sick older people are more vulnerable. So when you're thinking of heat sources, so how do we get, hot? Well, you have your external heat sources, which are the regular ones, hot weather, radiant heat sources. Then you have your internal heat sources as well. So your muscular activity, your digestion, your food, what's happening in your body that creates heat, right? So you have multiple sources, and then you really only have one source of cooling, which is your evaporation of sweat. This is what cools your body. Your body radiates heat as well. However, if the air is cooler than what your body is, the only way you're going to cool off is through sweat evaporation. So what happens? Sorry, I can't see. Okay. So what happens when I eat 1,000 calories? So where do they go, right? So if I'm going to go to Tim Hortons and have a meal here, that's roughly 1,000 calories if I have a bacon cheese melt. Where does that go? So our bodies aren't super efficient. So 300 calories will be used for work, towards your muscles and things. And 700 calories will be wasted as heat, just in your digestion. So that's a lot of heat that's just being dispensed, right, in your body. So again, that's your thermal regulation. So you have thermal regulatory mechanisms that help protect against overheating, and there's 4 physical processes that contribute to heat loss. So you have radiation, like I was saying. So as the heat goes to your skin and radiates, you have conduction, which is if you're touching something that is hot or cold. Usually we use conduction to warm ourselves, like holding a warm blanket, but you can use it to cool yourselves, just like a cooling vest, right? So if you have a vest on, it's touching your skin, it's cool, that will help cool yourself. And then you have convection, which is basically a source of wind. So wind going around you, and evaporation, which is the evaporation of your sweat. So radiation, if you see this, just, an example of that is the hot skin of this baby is radiating heat. Convection. So if you're thinking about a soup and you blow on your soup to convect the heat away from it, then it cools it off so that you can eat it. And then you have radiation and convection. They often work together because as your body radiates heat, the wind can come by and cool that, like cool your skin to kind of cool your body as well, right? It kind of acts like a radiator in a vehicle. So you have all of that going towards the radiator, then you have some wind going through the radiator, and then in turn it helps cool the engine down. Conduction, again, just touching something that's cooler or warmer. And then evaporation. So you got to think of this, as I mentioned earlier, if the outdoor temperature is warmer than your body temperature, the only method of cooling is evaporation of sweat, because convection and conduction will not work, or radiation, because the outdoor temperature is more than your core body temperature. The other thing to think about is during exercise or heavy workload and you start sweating more and more, 80% of your cooling loss or your heat loss comes from evaporation of sweat. So what do we need to do to protect ourselves? So besides finding cooler workplaces, think of the thermal regulation and the body's heat response to heat, right? So how do we cool ourselves? Well, fluid loss is a big thing. So obviously you want to stay hydrated. So 1 hour of moderate activity produces a sweat loss of 0.5 to 1 liter or more. So what happens when you have fluid loss? You have, reduced heat dissipation. You have increased heat storages. You have an increased cardiovascular strain, and a decreased capacity to work because people are feeling more fatigued and they're starting to make more mistakes or going under heat stress now. So what are strategies for this? Well, obviously you want to stay hydrated as best as you can. So if you know you're going to be working into heat stress the next day, you're going through a heat wave, you can follow hydration strategy similar to this. So it's called hyperhydration. So you're ingesting extra water before working in the heat, which offers more thermoregulatory protection. So the strategy is basically this. It's, half a liter the night before working in the heat, another half a liter in the morning when you wake up, and then, additional 400 to 600 milliliters 20 minutes prior to activity, and then consistent fluid intake throughout the day. So we recommend a cup of water or fluid every 20 minutes during a day. And what you're looking for is a fluid balance between your intake and your fluid loss. So how do we know we're hydrated? So there are different signs, but the major sign is through your urination. So if you're not, or if you're inadequately hydrated, you might not urinate as frequently. You'll have more weight loss. You'll have a strong odor to your urine, and you'll have a darker color. You'll probably fall into the not great or bad. And if it's very bad, then this is a medical. If your urine is brown, then you should be going to the hospital. This is you're extremely dehydrated and likely under heavy heat exhaustion. If you have adequate hydration, it's more clear, not completely clear. You don't want it to be completely clear. You want it to look similar to a light beer. So that is a very good indication of hydration. So electrolytes, so they do promote a more complete recovery during rehydration. They also help decrease urinary output, stimulate thirst mechanism, and they restore plasma volume more rapidly. So, drinking things like Powerade or quenchers, things like that have electrolytes in them. If you are going under heat stress, especially in the earlier stages, because your sweating isn't as efficient, where you are sweating more electrolytes at that point, your body hasn't really adapted to that yet. then we would recommend, drinking some electrolyte solutions. The one thing you have to watch out for though is if you have too much electrolytes, then you might have some muscle twitching, confusion. There's some different things that can happen with that. But then if you drink too much water, which isn't enough sodium in your body, then you're looking at swelling of your hands and feet, your whole body, really, headaches, fatigue, irritability, muscle weakness, cramping. There's quite a bit of things that so really, again, it's that balance, right? When you're drinking, you got to think of that. So typically the North American diet, you don't have to worry about this too much because the North American diet does have a lot of salts in it. So it does, your foods already have a lot of electrolytes. So you don't normally fall into this. However, if you're like a long distance runner and you know that you're going to sweat a lot if you're running in the heat, then hypernatremia is a thing, right? It's something that we see more in athletes. But again, it can happen in workers. So in the early onsets of heat waves or the summer where your body's not adapted to proficient sweating, then we would recommend, electrolyte supplements for this. So what factors can we measure for heat stress? So what are you measuring when you think about heat stress? Well, we have the Humidex plan, so temperature and relative humidity is a big indicator. We have the ACGIH TLV, so the wet bulb globe temperature, and we have physiological monitoring, so you can monitor heart rate, skin temperature, and this is more for complex heat stress programs where people are working in more extreme heat conditions. And we'll talk a little bit about these here. So why do we use the ACGIH? Well, it's the gold standard, right? It's basically the heat stress, or the Humidex plan is also based off of the ACGIH. So it is a gold standard. It's evidence-based. It's been updated, so we have a new one as of 2022. It contains detailed literature summaries, explanations of the TLV values, instructions on how to properly apply it, and it's considered the minimal professional practice standard for occupational health. So this is the most up-to-date document. They update it pretty well every year. Well, every year there are updates, whether it's heat stress or other hazards or agents, and that's why we use it. It's the most up-to-date. It's always there, and it's considered minimal professional practice. So with the ACGIH TLV, the 2022 version, so they added acclimatization, or climatized and unacclimatized workers. Prior to this, it never really specified that. It just had, action limit and then TLV, which the action limit was for unacclimatized workers and the TLV was for acclimatized workers. So there was a lot of confusion around that. So they brought back acclimatized and unacclimatized to make it clearer for people. And then we also have the metabolic category issue. So the problem with this is that, well, not the problem. We have to note that it does specify for adjusting metabolic rate based on body weight, right? Because this was done in the 60s, actually. All the studies for this were done in the 60s using young male military men, which were on average 154 pounds. So all of these workloads are based on that. So we have to adjust that for body weight. So if you have, a worker who's 195 pounds, well, they might fall into a moderate category when they're doing light work, or a heavy category when they're actually doing moderate work. We do have a calculation for that. I don't think it's 109. I think it's higher up. If you're, in the 240 pound range, then you would fall from light to moderate or moderate to heavy. But if you want more information on that, we can send you some information. And I think it's in the tool guide as well. So if you want to check out the guide, then it's there. So we're all different. So we need to make sure that we account for that. The other differences is there's biological sex differences, right? So if you're female sex at birth, then at a certain time of the month you're going to have ovulation and your body temperature goes up. This line here, this dotted line is 38 degrees. So when you're going through a menstrual cycle, your body already hovers around that 38 degrees. So it is typically higher. And it's the same thing when you're pregnant. As you have more hormones, you start to increase your temperature and going through menopause. So women are typically more at risk for heat stress when they are going through these stages in life. So it's something else to think about when you're looking at heat stress. So now we get into our prevention tools, right? So we have a new approach. It's a layered approach, but no approach here is really better than others. They're used in different contexts, but typically what we would like to see is supported self-management. It's simpler, it's more frequent. It allows workers to, self-manage their exposure to heat. But there are things that you need to know for this. So you're looking at this, so you can scroll down, like what's used more frequently is the support self-management, Humidex plan. Then we get into a little bit more detail in terms of the detailed TLV. And then if in extreme cases, you might have to get into physiological monitoring for more complex cases. So supported self-management, it only works if you have knowledgeable workers who have demonstrated they are able to recognize early signs and symptoms. They're supported by the supervisors, and they're provided the latitude to manage their work and their fluid intake. So this level of heat stress management cannot be followed without proper heat stress awareness and prevention training. So your workers, your supervisors need to be trained appropriately for heat stress, and they need to be able to demonstrate that training in order to really follow the supported self-management, where you're kind of leaving them at their own rate. They work at their own rate. They take their breaks whenever they need them. They take their water when they need it. You're really putting all your trust into your worker at that point, which is the most efficient way of managing heat stress. But you need a workplace who's going to provide that. It's not always feasible, but in most cases it is, where the workers can manage their own heat stress. Then we have the Humidex or WBGT estimate-based heat response plan. So this is a good hot weather plan as well if you are following a supported self-management. They kind of overlap all of these, right? So it's a good thing. So the Humidex heat response plan is a simplified version of the ACGIH TLV, and it's based on direct measurement of temperature and relative humidity. And then the measurements are converted to Humidex or WBGT estimates, and then there's prescribing preventative actions. So this is designed for workplaces without process heat, and for regular work clothing. So again, and it's for moderate workloads. It's not for heavy or very heavy workloads. If you are getting to heavier and very heavy workloads or process heat, or more clothing, then we would recommend that you go to the detailed TLV. This is using the official WBGT measurement. So we would recommend that if you are going through that, you would purchase the documentation for the ACGIH TLV and follow those methods. Then we have the TLV for physiological monitoring. So again, this is based on the ACGIH TLV, and it's more for tough to manage exposures or extreme heat conditions. So again, like someone like a firefighter, for example, who's wearing a lot of heavy clothing, they're working at a heavier rate. So their metabolic rate is either heavy or very heavy, but they still need to get the job done. So physiological monitoring is important in that case, so that their employers know what's happening, and they also have different plans. You're working for 15 minutes, you're in the fire zone, and then you're out, and someone else goes in, right? They kind of do a job rotation in that sense. You can also do physiological self-monitoring using, smartwatches or Fitbits or other apps. It's an unofficial approach, which you got to look at accuracy and validity of these tools. So that's another thing. So if you look at the physiological monitoring guide, it goes through a lot of that. And it's a good read. A little bit more technical, but a lot of information there for you to have. So again, when we're looking at supportive self-management, training is important. So your worker and your supervisors need to recognize early signs and symptoms, not only the workers. Everybody needs to be trained, and they need to demonstrate that knowledge. So again, it's supported by the employer. So the employer needs to give worker access to cool or shaded rest area. They need to allow them to take breaks as needed. They're able to manage their own work and fluid intake. You have a buddy system, so you have coworker observation with visual verbal cues, and everybody's trained on that. And you have a hot weather plan, such as the Humidex or the WBGT in case of extreme cases. So again, with this, you're using low-tech tools. So you might have a bulletin board that'll give you, a urine chart or a reminder about heat stress, things like that, infographics, just to remind them of what the health effects are and what it looks like when you're going under heat stress, what the symptoms are. So again, for the Humidex plan, so you need to apply this appropriately, right? So there are 4 or 5 steps when you're looking at the Humidex plan, and you should be following them. A lot of people were just, entering their temperature and relative humidity and then putting that in the form and getting their Humidex. They weren't getting their adjusted Humidex. So look at this here. This is adjusted Humidex and effective WBGT. So what does that mean? So adjusted means it's been adjusted for clothing and radiant heat. And effective WBGT means it's been adjusted for clothing and radiant heat. So you've added those adjustment factors in there prior to getting your response. So as you'll notice, we removed Humidex 2. We used to have Humidex 1 and Humidex 2. Humidex 1 was for unacclimatized work and Humidex 2 was for acclimatized workers. We removed Humidex 2 because we noticed that employers just assumed that everybody was acclimatized, so we removed that option. They were really abusing that. So if heat stress conditions allow for acclimatization, the workplace should follow the TLD. So what is acclimatization, right? So acclimatization requires physical activity under heat stress conditions like those anticipated for the work. And you need a recent history of heat stress exposure for at least 2 continuous hours for 5 of the last 7 days. And only at this point is a worker considered acclimatized for the purpose of the ACGIH TLV. So acclimatization declines when activity under heat stress conditions are discontinued. There's a notable loss after 4 days, and it can be completely lost after 3 weeks. And then a person may not be fully acclimatized to sudden or episodic higher levels of heat stress. So again, this is to the work that you're doing. So if you are doing moderate work or heavy work in these conditions, you can be acclimatized to that work. However, if you're going to start doing more work or heavier work, then you would have to re-acclimatize to those working conditions. So the other problem is working outdoors. It's very rare that people in Ontario would be acclimatized. So this is looking at our most southern weather station in Ontario. So it's probably the warmest weather station we have in Ontario. And we were thinking, we just looked at the summer months, July, August, September, and seen, okay, well, we had a couple of heat waves. Was there any opportunity for these workers, these outdoor workers, to be acclimatized without any process heat? So this looks at hourly data for solar radiation and wind data. So we had basically everything included here. So we looked at our heat wave in July. We really only had 3 days where we were above the ACGIH acclimatization threshold, which is 27.5 degrees Celsius WBGT. So we had 3 days. So we were partially acclimatized there. but not fully. And then we had a full 4 days here with no heat stress exposure. So now you're starting to lose, well, your acclimatization. And after 3 weeks, you end up with basically a total loss of acclimatization. You had, 1 day with 2 hours, 1 day with 1 hour, 1 day with 3 hours of heat stress exposure. But again, so you might have partially acclimatized here, but then you have, 7 straight days or really a full month of no heat stress conditions. And then 3 days in September. So when we're looking at this picture here, you can really see that there's no opportunity for an outdoor worker to be fully acclimatized to the work, or to work in the heat in Ontario. So that's the main reason we removed Humidex 2. People were abusing it. They thought all their workers were acclimatized when really they really weren't acclimatized based on the data that we're seeing. So how do we measure temperature and relative humidity? Well, you can have your dry or wet bulb. This is the old thermometer to measure relative humidity, or your sling psychrometer, and then you would take the difference between the two and implement it in this relative humidity chart, and it would give you your relative humidity. Or we have thermal hygrometers now. We recommend you just purchase one of these. They're relatively cheap. It gives you your temperature and your relative humidity with less than 5% error rate. So it's really good. So less than 0.5%, sorry, error rate. No, 5% on your relative humidity and 0.5 degrees on temperature. So it's pretty accurate. So we recommend just getting a thermal hygrometer, and it will give you a pretty accurate reading. And then you would enter that in your table. Something else to think about, time weighted average. So based on the ACGI HTLV, it's based on a 1 hour time weighted average. So you should be measuring every hour when the humidex is above 30 degrees, or a WBGT above 26 degrees Celsius, WBGTs. And then you need to measure at your workstation as well as your break area. So what happens if your worksite has a humidex of 40 and your break area has a humidex of 30? So what is a 1 hour time weighted average if you're taking 15-minute breaks every hour? Well, if you're taking 15-minute breaks, you'll have a 1 hour time weighted average of 37.5. So then you can add this to your response. So 37.5, what does that bring you? Brings you in, we'll say this zone here, 38, 39, we'll say, because you always add up or round up to 38. So it would be a 15-minute relief, which you are getting. So you are okay there. Again, you got to think though, if you are working in direct sunlight, you would add your 4 units of WBG or of humidex, which would bring you up to 42. So are you really getting enough relief? This is 45 minutes. If you're working in direct sunlight, you should be getting 45 minutes relief at that level. So again, measurement at your break and at the work site itself. So we also have this now in a WBGT table. So Thomas Bernard had some conversion tables to convert temperature and relative humidity into WBGT. So this is part of the new Humidex plan now, as well as we have a WBGT measurement or estimate. And if you're working in direct sunlight here, you would add 2.2 degrees Celsius WBGT to the estimated WBGT table. And again, we have your action here based on your numbers of WBGT or your temperature and what it looks like. So clothing adjustment factors. So this is another thing. So there are more. They've added the short sleeves and pants for clothing adjustment factor of a -1 WBGT. So when we're looking at this though, we typically have questions about, what if I'm wearing a leather gloves or a hard hat or a mask or earmuffs in addition to your overalls, right? Or regular work clothing. So what we did is we adjusted these values. We found a study that looked at all the heat loss in your body and what the relative contribution is. So there's no really adjustment factor for that. So we kind of found this and we did it ourselves. So we derived some numbers based on the relative contribution of heat loss during exercise. So this would be like over while you're working of 14 different body regions. And we were able to come up with some clothing adjustment factors for gloves, aprons, protective sleeves, leather jackets, N95s, our masks, toques, goggles, face shields, things like that. So we have a derived clothing adjustment factor based on that study that you can add. So this is all incorporated in our new online calculator as well, which we're going to go through soon. So again, then we fall into the ACGI HTLV. So this is a gold standard. So if you're getting a little bit more complex and you have some process heat and clothing, more clothing adjustment factors, then we recommend you go to the ACGIH directly. We recommend it if you're acclimatized as well. If you think you're acclimatized, working with process heat, any heavy or very heavy workload. Again, you want to make sure that you have all these steps. So training, metabolic correction for weight, outdoor sun or indoor sun, clothing adjustment factors, and acclimatization. So this is all in our new calculator. And then in more complex cases, we get into physiological monitoring. So it can be a useful tool in working in hot environments with high physical activity. There are concerns about collection and confidentiality of medical information. So if you do want to do this for your workplace, you really got to think about that. You know, what's the confidentiality piece? Often you need a medical person involved or physician involved to collect and hold medical information. Self-monitoring could be good. It can lead to self-calibration. It usually involves into supported self-management of that case, because you know you have your workers looking at their Fitbit. They're saying, okay, well, I'm feeling sluggish. I'm feeling hot. I got a little bit of a headache. What's my heart rate at? And they can see that. So their heart rate might be, you know, above 80% of their maximum because you know their body is under heat stress. But there's a lot more information in the monitoring guide, so I recommend you go have a read of the monitoring guide if you're thinking about physiological monitoring for your workplace. So the new heat stress calculator. So prior to providing the calculator results, there's 6 assumptions that you need to meet. So you have to, the program will take you through some forms, whether you know you want to have adequate training, you have to specify your clothing. You have to confirm absence of radiant heat, or if there is radiant heat, if there is some, it'll take you to the detailed WBGT. You have to specify indoor and outdoor exposure or shade exposure. You have to accept whether it's moderate unacclimatization assumption. If it's not, then it'll send you to the detailed WBGT. And you have to confirm your measurement location that is near the workstation, so within 10 meters. And only after these assumptions are met, it will give you the values of the Humidex or WBGT estimate or the detailed WBGT method. So let's go try this. Hopefully this works. I'm not sure if you can see. I might have to share my screen again here. Can you see the website that I'm at?
No.
Okay.
How
about now?
Yes.
Yeah, you can see the website? Okay.
Yep.
So if you go to our website, all of our information is here. We have some educational videos. We have some infographics. We have our heat stress calculator here. We have our 3 reference guides. So these are all downloadable in French and English. And I think they might be coming in Spanish soon. All our posters are French, English, Spanish, infographics as well. And we have a lot of additional resources. So this is kind of just taking you through the site. Now we'll go through the calculator here. So let's go to the calculator. So this is all new. This is a brand new calculator. We just developed this. Start here. So it'll give you two different methods, right? So really, what kind of data have you collected? So did you collect temperature and relative humidity? If so, you would click on that. Okay, well, let's go to the Humidex or the WBGT estimate. We'll do the Humidex for now, just quickly. Did I measure within 10 meters or 30 feet? Let's say yes. What's the current temperature? Okay, well, it was 32 degrees with a relative humidity of 60 yesterday. So we'll take that, which is pretty high. So now you have to, in order to keep moving, you need to confirm your training and knowledge. So let's say I haven't been training. It's been over a year since I've had any training. It was 10 to 30 minutes and it was only a video. It wasn't really interactive. But I can explain, what a heat rash is. I know what the symptoms are. I'm aware of muscle cramps. I can recognize heat exhaustion. I understand the dangers of heat stroke, and I understand that heat stroke is life-threatening. These are the minimal categories. If you can't click any of these, then you have an inadequate training program. But then there's a bunch of others, like, in terms of emergency, who do you contact? Do you know how to manage heat stress? There's a lot of other things here, right? So that you can enter. Let's just do that for now as an example. So here it tells you, based on the information you provided, your training delivery program is rated as inadequate and your training outcomes are rated as minimal. So the reason it's inadequate is because you only had a 10-minute video and it's been over a year. So that, typically you would want, if we go back, you would want, within the last 6 months or at least within the last year, with a 30 to 60 or more than an hour and in-person or workshop or interactive session where you're actually training and learning more about the symptoms and what to do in case of emergency. Okay, so let's go to the next one. So are you working indoors or outdoors, in the shade or in direct sunlight? So let's say I'm working outdoors in the shade. What kind of clothing are you wearing? So now you have to, in order to click here, you need to select your PPE. So I'm just wearing regular work clothes and gloves with a hard hat. Next, any additional moisture? No, we'll say no to that one. So now it gives you your summary, right? So you've had your calculation, you're using the Humidex plan, your temperature, relative humidity, your training knowledge. Yes, it's there, but it's not that great. You're working outdoors in the shade. There's no radiant heat moisture, and you're unacclimatized and moderate. So it's moderate workforce or workload, and you're unacclimatized. Let's calculate. So now it gives you everything. So I have a Humidex of 42 with a clothing adjustment factor of 0.8 degrees. So it gives me, which rounds up, it gives me an adjusted Humidex of 43. So you're falling into this category. And then it gives you your cautions here. So, you got to make, so the measurements you inputted were not taken close enough to the workstation, thus the calculated results may not be representative. So this is if you're just taking temperature relative humidity. It's just saying, a caution. If it wasn't, if it was, then it's more representative. Need to be aware of the measurement errors as well. So 0.5 degrees Celsius or 5% relative humidity, which can bring you, in a different range for Humidex. And it assumes that workers are working at a moderate work rate. So based on the information provided for your training and knowledge, it was inadequate and your training outcome is minimal. And what are the other assumptions? The assumption is that the measurements were within 30 feet, typical work clothing, and there's no additional exposures for radiant heat source. So if anything changes, you should redo this, right? So basically when you're measuring, if you're working under heat stress and you're measuring every hour, then you should almost do this every hour when you're working under heat stress. So now let's calculate another scenario. Let's go to the detailed WBGT. So let's begin here, and you can record this. Once you're done, you can print what you did. So let's go detailed here. So I do have a wet bulb glow thermometer in my workplace. So I'm gonna say yes. I've measured, because if you say no, then it'll take you back to the WBGT estimate. So then you click here, you have to restart, and you only have temperature relative humidity, and you want the WBGT, it'll bring you there. But let's say I do have one. I have a wet bulb glow thermometer in my workplace, and we have a temperature of, say, 28 degrees Celsius, WBGT. So again, we got to confirm our training knowledge. I'll say that it was within the last 2 months. It's over an hour, and it was in person. And I know all of these. So yeah, I understand heart rate, no stress limits, getting water, aware of emergency procedures, understand body generates heat. Let's just say I know all of these. So just click them for an example here. So now, based on the information I provided, your training delivery program is rated excellent, and your training outcomes are rated as excellent. Okay, so I'm working outdoors in direct sunlight here. Let's see. And PPE, let's select some PPE. So do work clothes. Most of the time we're work gloves and a hard hat again. We can add, let's say I'm doing some welding, leather welding jacket. So is there any additional radiant heat sources? Well, we could say yes to this one just for an example. So specify acclimatization information. So you would check all that apply here. So is it a large scale metalworking fluid or other operation handling large quantities of water or aqueous solutions, large number of ovens, molten gas, poorly ventilated laundry, dishwashing, product heating, drying operations. So we'll say we're working on hot pavement because I said we're working outdoors. And the process heat is between 100 and 260 degrees Celsius. And I'm 1 to 3 meters away. Some might be less than 1 meter away, even if they're right by the hopper. But I'm a laborer. I'm about 1 to 3 meters away, I'll say. Is there presence of barriers? Not really, no. And what time am I exposed to this? So it's more than 20 minutes per hour if I'm working normally. Next. So what's the work rate? So if I'm a laborer here, I might be doing some heavy work. I'm shoveling asphalt and, raking. Could be moderate to heavy. So let's say heavy. And if there's a lot of people there, then we'll say there's multiple workers. So you can add their weight, right? So the lowest would be, let's say 40. And the highest, well, you can have up to 250-pound workers, sometimes more. And then, are you female or not? Are there females in your group? If there are females, you would say yes. So now it gives you your summary again. You're using the WBGT method. Your wet bulb glow temperature is 28. You have a knowledge of training. You're outdoors in direct sunlight. You're wearing typical PPE as well as, gloves, leather welding jacket, hard hat. You probably wouldn't have a leather welding jacket if you're on the if you're working on asphalt, but just for examples. And you're acclimatized here. So it gives you whether you're acclimatized or not, and you're working with a heavy workload. So looking at this, so it gives you the effective WBGT numbers for acclimatized workers here. So then you would have, you know, again, you fall into this work zone. So your response would be work for 45-minute release per hour and can contribute if feasible and additional provisions listed above. So providing adequate water and all that. So your effective WBGT is 29.9 degrees Celsius. So again, no, never ignore anyone's signs and symptoms regardless of measurement. This is basically everywhere in the guide. This is the most important thing here. Do not ignore anyone's signs and symptoms regardless of the measurement. If the measurement is even at less than 24, if someone has signs and symptoms and they need a break, they should be taking it. So again, you can download this PDF and print it yourself, or you can just leave it at that and then create another scenario in an hour or so. But if you need it on record, you just click download and that's it. It'll let you save. So that is basically it. Thanks for your attention. If you have any questions, you can email ask@ochow.ca, or you can email me directly. I didn't put it on here. I'll do that now though, so that if you want to get a hold of me, you can email me. So that is my email there. If you have any questions, you can give me, you could send me an email and I'd be happy to answer them for you. I know we went a little bit over time, but is there any questions?
Thank you, Andre. It's really, really great information you're sharing with us. I think there's tools, the calculator, everything is so grateful and beneficial for all the workers. There are two questions on the chat. Will you be able to see it? I think three now. Probably we just take a couple minutes just address those questions. If you have more questions, you could just directly email Andre. That'd be great.
Okay, so let's see here. How do we calculate the humidity if using calculator for inside workers, specifically referencing manufacturing where the plant is not air conditioning? So again, you measure the same way. So temperature and relative humidity, you would measure that using a hygrometer. You can, if you're 10 meters away from the source or from where people are working, within 10 meters, so within 30 feet, you could just take a hygrometer, measure the temperature, relative humidity, and add that to your calculator. And there's another question here for underground. So is it considered inside or outside? Underground would be considered inside. It's the same measurement as inside. So if you're outside in the shade, it's still considered as you're using the same calculation as inside. Is there a glossary with the tool for the? Yes, there is. I'm pretty sure there is. There's definitely definitions in the tool for everything. How would OFL's campaign calling for heat stress legislation make a difference for workers in Ontario? Well, what's nice about legislation and regulation in Ontario for that is that it would force workers or force employers to implement a heat stress management plan. Right now, based on the general duty clause, workers have the duty to make sure their workers are safe at all times, or to protect, they have the duty to protect their workers. So they could, it's kind of, they could take that in different directions, right? Whereas if you have a heat stress regulation or legislation on heat stress, then they're mandated to do that. They have to have these things in place, these programs in place to manage heat stress. So that's where it will help. Because there's a lot of employers out there that are working in direct sunlight, that are working, outside, in the heat and in heat waves, and they don't have a heat stress management plan. So if it's legislated, then it forces them to have it. Would regulators accept these calculations? They should. It's all based on the ACGI HTLV. So they should accept this, yes. It's about the Humidex2. Using the calculator, selecting the Humidex method, can you account for metabolic workload, or is the assumption moderate unacclimatized work? So if you are using the Humidex method, the assumption is moderate unacclimatized work. If you think your workers are acclimatized or you're doing heavy to very heavy work, we recommend you go directly to the ACGIH PLV. It's more detailed. It's better at capturing that, where the Humidex plan is not. So again, yeah, if you're doing heavy work or you think your workers are acclimatized, better off going to the ACGIH TLV. And it looks like that's everything.
Oh,
that
I think we just take one more question, then we have to wrap it up.
Yeah. Yeah, I can't see any other questions.
How would biological testing come into play with this plan?
Oh, yeah, okay. Well, that would be physiological monitoring, right? So this would be in extreme heat cases. So anytime you're working above 45, a 45 Humidex, or what is it for WBGT? Basically 30, so 29.1 degrees C WBGT. It's only medically supervised work. So this is where you would have physiological monitoring, and that's basically mandatory at this point. And that would work because you're able to see what the body's response is to the work, right? That's how biological testing works. So if you're taking heat stress and temperature, you would have, whether it's, you want to measure core temperature as best as you can. So in the field, the best way to do that is through a tympanic thermometer. That's not getting hit. It's more accurate. It's closer to the brain. You're not getting any, you're not getting variations from wind. Like if you're walking up a tunnel, for example, in the mines, and you have just a skin temperature band on to measure skin temperature, but the wind comes by and blows by you. Well, your skin all of a sudden is cooler, right? So it's not really an accurate measure, where if you're measuring temperatures through the year. But the best, if you only have one, we measure heart rate. If you only have one way to measure, you can measure heart rate. That could be through, a band, your Fitbit, which are pretty accurate. But again, you want better contact. So now they have armbands that you can wear, so it has better contact. And that will kind of show you whether you're going under heat stress or not. So you would measure, 80% of that worker's maximum heart rate. So maximum heart rate is 220 minus your age, and then you would take 80% of that, and then that would be an indicator of heat stress. So once you're at that 80%, they're under heat stress, you would take them out of the heat, and then you'd give them a break, and then make sure that their heart rate is coming down. If it doesn't come down within a minute or two, within a minute, then there could be well, that they're under heat stress, first of all, and that their body is more stressed than just regular heat stress. So you got to give them longer breaks, longer period of rest and recovery. So that's kind of how biological monitoring works. But yeah, it can be very complex, and you need a complex heat stress management program for that.
Thank you, Andre. I think we have to wrap up the session here because this is about 15 minutes beyond the scheduled time,
For sure.
But on behalf of the Occupational Health Center, thank you so much. You gained this really informative session, and then the demonstration of how to use the calculator is really, really important too. So I got all your emails, for the request of the slide and the recorded session. I will send out to you. And any folks have more questions, please feel free to directly email André, to have request more information on that. So on behalf of the OHC again, thank you all of you joining this session this morning with us in the Friday morning. It was a beautiful morning here in Manitoba. I was told by Andre it's a little bit raining, kind of rainy Ontario. But hope you all have a really, really great weekend and enjoy the summer. Okay, see you next time. Bye.
Thanks. Take care.